If you're over 70 and your hips or knees ache every single morning when you get out of bed, or climbing even 3 stairs feels like climbing a mountain, I want you to know you are not alone. And more importantly, this is not the end of the road.
Most people with osteoarthritis are told to rest more, move less, and simply manage the pain. But here's the thing, that advice, when taken too far, can actually make things worse, much worse.
Today, we're going to share with you the 5 best exercises specifically chosen for men and women over 70 who are living with osteoarthritis of the hip and knee. These are not random gym exercises. These are carefully selected movements that respect your joints, your balance, and where your muscles are right now.
And before you think, I can't exercise, my knees are too bad, stay with us. Because by the end of this video, you will have a complete, safe, and doable routine that can genuinely reduce your pain and help you move with more confidence day to day.
But first, tell us in the comments right now, which bothers you more, your hip pain or your knee pain? We read every single comment, and we'd love to know what you're dealing with.
Now let's get into it. But before we talk about the exercises themselves, there is one critical safety rule that applies to all 5 of them, and we need you to hear this first.
Always exercise near a wall, a sturdy chair, or a countertop. At this stage of life, balance can be unpredictable, especially when muscles around arthritic joints have weakened over time. Never exercise on a slippery floor. Wear supportive shoes, not socks alone. And if you feel sharp joint pain, not the normal, mild discomfort of movement, stop immediately. Mild achiness during gentle movement is okay. Sharp or stabbing pain is your body saying, not today.
Also, if you've had a hip or knee replacement, please check with your doctor before starting any of these exercises. Some movements may need to be modified for your specific situation.
Now, with that foundation in place, let's talk about exercise number 1. Exercise number 1 is the seated knee extension, and we are starting here for a very specific reason. This exercise requires no standing, no balance challenge, and puts almost 0 pressure on the joint itself, while still activating the quadriceps muscle, which is the muscle group most responsible for protecting your knee from further deterioration.
Here's how you do it. Sit tall in a firm chair with both feet flat on the floor. Slowly lift one foot off the ground and straighten your leg out in front of you as much as your comfort allows. You don't have to get it perfectly straight. Hold it there for 3 to 5 seconds, then lower it slowly back down. That slowness on the way down is where much of the strength benefit actually comes from.
Do this 10 times on each leg. If that feels too easy after a week, you can add a small ankle weight, but start with body weight only. The goal here is to rebuild the muscle around the joint, because strong muscles act like natural shock absorbers for arthritic knees.
One thing to watch, don't hold your breath. Breathe out as you lift and breathe in as you lower. Many seniors unconsciously hold their breath during effort, and it raises blood pressure unnecessarily.
Now here's something to keep in mind as we move toward exercise number 3. There is one movement in this list that most people with hip arthritis are actually avoiding out of fear, but doctors and physiotherapists agree it is one of the most healing things you can do. We'll get to it soon, so stay with us.
Exercise number 2 is the standing hip abduction. This one targets the muscles on the outer side of your hip, called the hip abductors, and these muscles are critical for walking stability and for reducing the grinding pressure inside the hip joint.
Stand behind a sturdy chair and hold the back of it with both hands. Keep your feet hip-width apart. Now slowly lift one leg out to the side, not forward, not backward, directly to the side, about 6 to 10 inches off the ground. Hold for 2 seconds, then lower it slowly. Repeat 10 times on each side.
The key safety point here is to keep your upper body upright. Many people lean sideways to compensate for limited hip mobility. If you're leaning, you're doing it wrong and putting unnecessary strain on your lower back. Instead, reduce the height of your leg lift. A small, correct movement is 10 times better than a big, sloppy one.
This exercise might feel almost too easy at first. Trust the process. The hip abductor muscles in most people over 70 with arthritis have been inactive for a long time. Gentle reactivation is the goal.
Exercise number 3 is the heel-to-toe wall sit, and this is the one we hinted at. Many people with knee arthritis avoid any form of squatting or bending the knee under load, and while deep squats are absolutely not appropriate, a very shallow wall sit is actually one of the most powerful exercises for rebuilding the stability around an arthritic knee joint.
Here's how to do it safely. Stand with your back flat against a wall, feet about 1.5 feet away from the wall, shoulder width apart. Now very slowly slide down just a few inches. We're talking about the equivalent of sitting down on a very high stool. Your knees should not go past your toes. Your back stays flat on the wall the whole time. Hold this position for 5 to 10 seconds, then slide back up.
If 5 seconds feels like a lot, start with 3. This is not a competition. Over time, as the muscles around your knee grow stronger, this will become easier. The wall provides balance support, which makes this safe even for those with significant balance concerns.
Do 5 repetitions to start. Don't push for more in the first week. Your muscles will tell you they worked the next morning, and that's completely normal. Soreness in the muscle is different from pain in the joint. Remember that distinction.
And now we're coming up to exercise 4, which addresses something very specific that most people with hip arthritis suffer from, but rarely associate with their hip pain at all. Once you hear this, it will change how you think about your body.
Exercise number 4 is the supine knee-to-chest stretch. This one is done lying down on your back, which means it is one of the safest options in this entire list for people with severe arthritis, balance difficulties, or anyone who gets dizzy standing.
Lie on your back on a firm surface, a yoga mat on the floor, or even on a firm bed if getting to the floor is too difficult. Bend one knee so your foot is flat on the surface. Now, gently bring the other knee toward your chest, holding it with both hands behind the thigh, not behind the knee joint itself. Pull it gently toward you until you feel a mild stretch in your hip and lower back. Hold for 20 to 30 seconds, then switch sides.
Here's why this matters more than people realize. One of the hidden drivers of hip osteoarthritis pain is tightness in the hip flexor and surrounding soft tissue. When those tissues are chronically tight, which happens naturally from prolonged sitting, they change the mechanics of how your hip joint moves, increasing grinding and discomfort. This stretch directly addresses that tightness.
Do this twice on each side. Breathe deeply throughout. Never pull hard or bounce. The stretch should feel gentle relief, not strain.
And now exercise 5, the calf raise. This one surprises people because it doesn't seem directly connected to hip or knee arthritis. But here's why it belongs on this list and why it might be the most important one for your long-term independence.
Stand behind a chair, holding the back for support. Rise slowly up onto your toes. Hold for 2 seconds at the top, then lower slowly back down. That's 1 repetition. Do 10 to 15.
The calf muscles, when strong, act as a secondary pump for circulation in the lower legs. People with arthritis in the hips and knees often reduce their activity, and that reduced movement contributes to swelling, stiffness, and poor circulation, all of which worsen joint pain in a cycle. Strong calves break that cycle.
Beyond circulation, calf strength significantly improves balance in older adults. Falls are one of the leading causes of serious injury after 70, and this one simple exercise done daily can meaningfully reduce that risk over time.
Keep your core gently engaged, don't lock your knees, and rise and lower with control. If you feel calf cramps during the exercise, you may be dehydrated. Drink a glass of water before you begin next time.
So let's bring all 5 of this together in a quick summary. Exercise 1, the seated knee extension, rebuilds the muscle that protects your knee joint without putting you at any balance or weight-bearing risk.
Exercise 2, the standing hip abduction, restores the outer hip stability that makes every step you take safer and less painful.
Exercise number 3, the shallow wall sit, re-engages the full muscle system around your knee in a controlled, supported way that is appropriate even for moderate arthritis.
Exercise number 4, the knee-to-chest stretch, releases the hidden tightness in your hips that is silently amplifying your joint pain.
And exercise number 5, the calf raise, builds the lower leg strength and circulation support that keeps stiffness and swelling from winning.
Do these 5 exercises 3 to 4 times per week. Not every day. Your joints and muscles need recovery time too. Start gently, progress slowly, and trust that consistency over weeks is far more powerful than intensity over one day.
And here's the final thought we want to leave you with. Osteoarthritis does not mean your active life is over. It means your body is asking you to move smarter, not less.
Every one of these exercises was chosen because it works with your joints, not against them.
Now, we want to hear from you. Which of these 5 exercises are you going to try first? Drop it in the comments below. And if you found this video helpful, please share it with someone over 70 who is struggling with hip or knee pain. You might change their life more than you know. And before you go, we want to ask you something. While we talk today specifically about hips and knees, there is one area of the body that almost always gets affected alongside those joints, and that is the lower back. When your hips are stiff and your knees are weak, your back quietly takes on extra load every single day. And over time, that builds into its own source of pain and limitation.
If you or someone you care about is also dealing with back pain on top of everything else, we have already done the work for you. We put together a video called Over 60 with Back Pain. These 3 safe exercises can help. And just like today, every single movement in that video was chosen with older joints, real balance concerns, and true safety in mind.
It is a short, focused watch, and by the end of it, you will have 3 more tools in your hands that work alongside everything you learned today. Think of it as the natural next step from this video.
You'll find it linked right here. Go ahead and watch it next. Your back will thank you for it.